So we're going to start off. The title is Simplified Heart Diagram. Simplified Heart Diagram. Simplified heart diagram. I'm going to clarify this. So make sure you draw more in the middle, big enough to have a lot of room around the area so that you can add things and draw. Traditionally, an anatomy drawing, you are not supposed to have lines being crossed. So a certain level of planning, it's important. A certain amount of room on the side is also very, very important. So use pencil to start. Okay, so I'm going to ask you to start drawing a simple something that looks like a box, but there will be a couple of openings, so to speak, to start with. Okay, and in the middle, a relatively thick wall, shaded in. Also, you're separating this into two. Usually the top is smaller. Again, an opening. Leave some space here. Leave some space here. And also some space here. Close that. Okay? This tube is going to go all the way down to this bottom side. This tube is also going to go all the way through this opening to the bottom side. Okay? And on this side here, you're going to draw a little bit this and shade that in. Okay? So, just that for now. We're not done drawing, but we must stop here, let you guys catch up, and then continue.
Ceiling supposed to be as small on that side?
What do you mean?
Did you purposely make like the small exit from the chamber there?
This here doesn't matter.
No, like
Should be
the
around.
other two.
This?
That.
No, it doesn't have to be.
Okay, you can.
Put up your hand if you're done. Okay, give you 1 more minute. Now we're going to start labeling things very soon. And one thing about anatomy is this. When we start labeling left and right, we are not talking about your left and right. We're talking about the specimens left and right. So in this case, in this situation here, when we're talking about left side, right side, imagine if I'm the specimen, this will be my right. Okay, so this side will be my right, your left side. Okay, This will be my left side, your right side. Okay. So when we're labeling right atrium, left atrium, make sure you keep in mind that, oh, it's the specimen's position when it's facing towards you. Now, this here, so your heart is a 4-chamber heart, 4 rooms. So this, we're going to start here, left atrium, LT, left atrium. This will be left ventricle, left ventricle. All right. On this side here will be the right RT, atrium. Down here, right ventricle. Okay. Now, this here is a wall that separates the right side of the heart with the left side of the heart. This wall is called septum. It is a Latin word, really meaning wall. Okay. So, the 4 chambers: right atrium, left atrium, right atrium, left ventricle, right ventricle. Now, just a reminder too, I'm going to use color coding too, as well as a little bit legend on the bottom down here, because there's more room. Keep in mind, veins carry blood back to the heart. Artery carry blood away from the heart. Okay. I'm going to use red for oxygenated blood. So blood that has lots of oxygen in it. And I'm going to use blue for deoxygenated blood. Blood that doesn't really have a lot of oxygen on it. Okay. How are we doing? Okay. So this part here, don't worry if you, I'm going to give you 30 seconds to copy that down, but do remember I'm recording this, so I'm going to post that up afterwards so you can see it and catch up on certain details in case you missed it. Okay. Now we have the basic structure of the heart. Now let's talk about blood flow as well as the blood vessels. Now we'll start our story on the on the right side. Now, on the right side of the heart, up here, this is, you have deoxygenated blood coming back, blood from the rest of the body. So in this case, deoxygenated blood will go back to the heart into the right atrium through this major blood vessel called vena cava. Vena cava.
So this blood lacks oxygen.
Yes, less oxygen. Vena cava is a vein. Just double checking. Okay. Now, the deoxygenated blood will come into the right atrium through the vena cava. Vena cava collects all the blood from the rest of the body. Now, the blood will go from the right atrium into the right ventricle. Now, in order to do that, it has to go through a valve, okay? A valve. So this valve here is called the tricuspid valve. V-A-L-V-E. Tricuspid valve. Okay. So it's called tricuspid because if you actually take a look at the picture of it, it actually looks like 3 cups coming together to form the valve. Okay. And the purpose of the valve is to make sure the blood only go one way and not the other. Okay? It's only make sure that blood flow only go from the right atrium to the right ventricle, and it cannot go back. It's important for that. This is also, if you hear people is like, oh, this person's having a heart valve surgery, you know that they probably have to go cut open the heart and change the valve or do something to it. Okay?
Wait, Mr. Chang, does that valve open and close, or is it just?
It opens and closes. Every single, we'll look at the structure using the simulator a little bit later on, but we're going to do this first. Okay? Yes? No? So deoxygenated blood will go from the right ventricle atrium into the right ventricle through the tricuspid valve. Now, the right ventricle, when it contracts, when it squeezes, it will push the blood out of this major blood vessel. Now, this major blood vessel has a name. This is called the pulmonary artery. Okay? This is called the pulmonary artery. Pulmonary artery, and this blood vessel also has a valve down here called the pulmonary valve. Pulmonary valve. Again, the valve is to make sure when the right ventricle squeezes, blood will only go up this way and not back up to the atrium. And once it gets into the artery, it's not going to flow back. Very, very, very important. Okay. By the way, one thing about the septum I didn't mention earlier, sometimes you might hear like people talking about, oh, this baby have a birth defect where they have a hole in the heart. This is where they're talking about. There would be a hole that is either in between the 2 atrium, it could be in between 2 ventricle, or somewhere in between here too. Okay, so this is where that can happen. It's usually a developmental issue. There are surgeries that can help. I'm not sure how. Depends on the degree. Okay. There are meds. Yeah, there are also meds that can help too. So the deoxygenated blood go out of the ventricle through the pulmonary artery, and this is to the lungs. To the lungs, you can tell because it's pulmonary. Pulmonary is always about breathing and lungs-ish. And to go to the lungs to get oxygenated, okay? These are deoxygenated blood. They are to get rid of the CO2 and pick up more O2. Okay. Now, the blood get oxygenated, they have to come back. So in this case, you go through another blood vessel on the opposite side now. So this side here, this is the pulmonary vein. Pulmonary vein. And oxygenated blood will go into the left atrium through the pulmonary vein. So blood from the lungs, okay? Blood from the lungs go into the left atrium. Now the left atrium collects the blood that comes from the lungs. Afterwards, the atrium will squeeze. It pushes the blood from the left atrium down to the left ventricle. Now, I'm just going to make it a little bit bigger because it does look severely unparalleled to each other. It goes through this valve. Now, this valve here has two possible names. You can call it either bicuspid valve, because it is really two cups. If you look at it, it's like two cups. Or mitral valve. I'm not exactly sure why it's called mitral valve, but just know the name. Okay? So it's either bicuspid valve or mitral valve. So the oxygenated blood will go from the left atrium through the bicuspid valve or mitral valve down to the left ventricle. The left ventricle, the blood, oxygenated blood at the left ventricle, now when the ventricle squeezes, the oxygenated blood will go out of the heart through this blood vessel. Now this blood vessel is called, anyone happen to know? Aorta.
Oh.
Okay? Aorta. It is an artery. Okay, I'll just put a box next to it so it doesn't get confused. And this blood vessel also have a valve down here. Okay? And that is called the aortic valve. So the oxygenated blood will go through the aortic valve, go out of the aorta. Now, this is oxygenated blood, so it will go to the rest of the body. Okay? Any questions so far? Now, one thing I want to ask you guys is this. Why do you think here the wall looks a lot thicker on this side versus this side? Okay, yes?
Is it because the oxygen creates more pressure?
Not exactly. Those 2 points are related, but not in that manner. Yes?
In the left ventricle pumps all the blood to the entire body for uniform pressure, like pushes out faster.
Okay, good. So in this case, if you think about it, right ventricle, you push the blood to the lungs, which is really just next door to the heart, not far. Left ventricle, you push the blood to the rest of the body. That's talking about to the top of your head, to the bottom of your foot. That requires a lot more force, and you have to generate a lot more pressure. So the wall of the left ventricle, you always draw a little thicker, and I'll say thicker muscular wall. Okay. In the past, when I actually get students to do fresh specimens, you can easily see that. Okay. Let's hope we can tell that in the fetal pig next week. Okay. Or the week after. Any questions so far? Yes. I'm going to zoom out a little bit. So, by the way, this is recorded too. So if there's anything missing, you can look at the recording. Okay. So I'm going to summarize this. Actually, before summarizing it. So in this case, because it takes more pressure for the left ventricle to squeeze the blood to the rest of the body. Now, let me ask you this. How can you tell if in a cut, you got a cut on a artery or a cut in the vein? In the first stage situation, how can you tell if someone have accidentally got their artery cut or the vein cut? Yes?
Does it have something to do with the way the blood clots?
Not quite the blood clot, well, difficulty of the blood clotting, but yes.
Maybe like the amount of blood that's exposed in the body?
Amount of blood, that's true. You can usually tell by the amount of blood, but keep in mind, the blood coming out from the left ventricle is under a lot of pressure. So typically, if a artery was cut, the blood will squirt. Okay? Because it is under a lot of pressure, right? But if it is a vein, okay, it doesn't have a lot of pressure at that point already, so it will seep out. Okay? So we can tell by the way the bleeding too. This is also one reason why if a nurse is trying to either give you medication through IV or they're trying to do a blood test and draw blood from you, it's usually from the vein, okay? Questions? Okay, so let's summarize the cycle a little bit. So deoxygenated blood comes from the rest of the body, go into your right atrium here through the vena cava. Then the deoxygenated blood from the right atrium, after it collects it, it will go into the right ventricle through the tricuspid valve. Later on, when the ventricle squeezes, contracts, the deoxygenated blood will leave the right ventricle. It goes through the pulmonary valve, goes to the pulmonary artery, to the lungs to get oxygenated and get rid of CO2. Afterwards, blood that are oxygenated will come back from the lungs into the heart through the pulmonary vein into the left atrium. When the atrium contracts after it pulls the blood, it goes down through the bicuspid valve or the mitral valve into the left ventricle. The left ventricle, when it contracts, it will push the blood through the aortic valve into the aorta, and that goes to the rest of the body. Because you need to create more pressure, it has to pump harder on the left side, you usually would tell from a thicker muscular wall from the left atrium. And this is also one way for you to like position and see, like if you have a heart just by itself, which is the left, which is the right, well, you can tell by the thickness of the ventricle wall. Okay. Any questions? Okay, so good job on the simplified heart diagram. Yes.
For example, if the bicuspid or mitral valve was like, if the valve hurts, one is like way longer than the other, but possible like complications could you have?
That you have to look it up. Okay.